Assalamualaikum. I hope you all are doing good. आज का जो हमारा सेशन है वेरी ऑन अ वेरी इंपॉर्टेंट टॉपिक जो हम आज डिस्कस करेंगे आप लोगों के साथ स्पेसिफिकली ऑन प्रॉब्लम सिंड्रोम टुडे as you all know that today is basically problem syndrome day as well, world problem day, like research process. So the topic of our today's session is beyond dry mouth, the dentist role in detecting problem syndrome. So let's discuss. It's a special webinar. As you all know, my name is Dr. Mohammad Farooq, and I'm founder of Pride as well as the field industry. Alhamdulillah, I have around 37 research publications with my name. जिसमें से 5 international journals published हैं, and I'm having my own clinical practice with the name of Dr. Farooq Indian Clinic. So this is a little bit introduction about me. Okay, talking about objectives, we have first we will discuss about how what is understanding the Sjögren syndrome, ठीक है, and then we will recognize all the manifestations of it. Then हम इसकी identify करेंगे patient requiring referral. Then we will move toward managing xerostomia effectively, and in the end we will go ahead. How can we improve the quality of life through early diagnosis? Okay. The first case of our today's is basically we start with an opening case. A 42-year-old woman visits your clinic complaining, Doctor, I keep getting cavities despite brushing twice daily. She also says, my mouth always feels dry. Water never seems enough for me. So in this scenario, you can see the picture as well. The patient's lips are also dry. Patient's eyes are also swollen and they are dry. And patient is complaining that he is getting again and again cavities, basically, and he is unable. He is unable to basically maintain the hygiene, hygiene proper because her oral cavity is dry. Okay? So what would you diagnose in this case? Would you diagnose it as a case of poor oral hygiene? Would you diagnose it the case of high sugar intake? Would you think it's basically because of the medication side effects he might be taking? Would you diagnose it as a Sjögren syndrome? So this is a very important thing to think. Uh, this is basically a case of Sjögren syndrome. Why this case matters? Most Sjögren syndrome patient visits you first, then before visiting physician. Okay? So basically, you are the first person who has encountered them and who is seeing them, and you have to see their symptoms and then decide whether to refer or wait in which case. Okay. So dentists are the first line people that the patient visits before physician. Okay. Every delay in diagnosis can occur 4 to 7 years. The patient might not think that he or she has Sjögren syndrome. In this scenario, many patients lose their teeth before diagnosis because they don't know that they have such a condition called as Sjögren syndrome, and then this can change it as well. Okay. So what is Sjögren syndrome? हम बात करें Sjögren syndrome है क्या? Sjögren syndrome is basically an autoimmune disease. Okay, it is basically the disease of the immune system that is affecting your own immune system. Okay, immune system is basically being attacked by your own cells, body cells. It basically affects salivary glands, it affects lacrimal glands, it leads to the dry mouth, it leads to dry eyes. Okay, so how it can also affect the kidneys, it can also affect the lungs, it can also affect joints, it can also affect liver, it can also affect nervous system. Okay, so talking about epidemiology, it basically occurs more in women than the males. The percentage of Sjögren syndrome occurring in the female is more compared to the male. It's around 9 to 1 ratio. Okay, so it occurs at the peak age, like in the adult, you can say ages like 40 to 50 years. Millions are affected worldwide. Many remain undiagnosed. Okay, so what is the difference between primary versus secondary syndrome? We have two types of Sjögren syndrome. Primary syndrome it is basically only Sjögren syndrome. Secondary, basically, it is associated with rheumatoid arthritis, lupus, scleroderma, other conditions as well. Okay, so why dentists are important? Dentists are important because patient notice you note in patients that dry mouth or dry eyes, dental caries appear early, and dentists become the first healthcare provider. So in this case, that's why dentists are important diagnosing the this disease, Sjögren syndrome. So, talking about the normal saliva, the function includes lubrication, as you all know, digestion, taste, heat, protection, immunization, antimicrobial action. What happens without saliva, basically? As you all know, without saliva, then the patient will have dry mouth in medical term, which we also call as xerostomach mouth effect. So, what does the xerostomia does to the mouth, by mouth? It leads to rampant caries. It leads to difficulty in eating. It leads to difficulty in speaking. It causes burning of mouth. It causes candidiasis, and it causes bad smell, which is basically halitosis, and it leads also to the poor dental retention. So these are all the signs and symptoms with a dry mouth or xerostomia patient you can see. Clinical features, what you can see in the patient are the patient with the xerostomia or dry mouth or Sjögren syndrome would be having dry mouth, dry eyes, fatigue, joint pain, carotid swelling, difficult swelling, and frequent dental decay. Okay, so talking regarding the oral manifestation, we basically see in these patients rampant cervical caries. There is sticky saliva, tongue. There are a lot of tongue stitching, as you can see in the picture as well. Angular burning mouth syndrome, candidiasis, and difficulty wearing lenses. So, what are the red flags every dentist should know? Patient carries water bottle. The patient uh, drinks water a lot because he or she feels that the water is not enough that they are getting. Lipstick basically stick to the teeth. Mirror stick to the buccal mucosa. Cotton roll stick. This test you perform yourself. Mirror when you place the mirror for reflection, mirror gets stuck into the buccal mucosa. Okay, cotton roll sticks, you can see this as well. And dry cracked lips, you can observe like in this picture, and no pool saliva. There is no sign symptom of saliva there. You can see. Interesting case, there is another one. Patient has basically a multiple cervical caries by mouth, difficult swelling crackers. What should you suspect? In this case, what should be your diagnosis? Basically, this is also a case of Sjögren syndrome. You can see in this picture, clinical picture as well, there are multiple cervical caries, last five cavities. Taking history, what you can do is you can ask the patient, do you wake up at night to drink water? Do your eyes feel gritty? Gritty means basically sandy. आपकी आंखें ऐसी लगती हैं कि बेसिकली उनमें आपकी आंखों में चुभन होती है, उनमें ऐसे रेत गई हुई है. ठीक है, आप ये पूछ सकते हो. डू यू नीड वाटर वाइल ईटिंग? आपको पानी की जरूरत पड़ती है जब भी आप खाना खाते हैं? एनी ऑटो इम्यून डिजीज आपको है कोई बीमारी? ठीक है, करंट मेडिकेशन आप कौन सी ले रहे हैं? एंटी डिप्रेशन वगैरह तो नहीं ले रहे? ठीक है, तो उनसे भी आपको पता है बेसिकली ड्राई माउथ वगैरह होता है. तो मेडिकेशन इंड्यूस्ड ड्राई माउथ क्या हो सकता है? वी कैन द पेशेंट कैन बी ऑन एंटी डिप्रेशन, द पेशेंट could be on antihistamine, anti-allergic, ठीक है, anti-hypertensive, antipsychotic drugs. This also led to the very much dry mouth. And you should then differentiate Sjögren syndrome, either the patient has syndrome or not, because these drugs also cause dry mouth. If you know that Sjögren syndrome, the first clinical presenting complaint is basically dry mouth. Okay. Clinical examination, what you do in clinical examination, you inspect the oral cavity, inspect the tongue, palate, floor of the mouth, salivary pooling, parotid enlargement, palpate the parotid gland, and see it. What we can do on the chair side saliva assessment, you can perform a mirror test, you can perform a bubble test, you can perform a salivary pooling, or you can check the saliva consistency as well. Okay. So, what is diagnostic criteria for measuring? You need to first examine, take a detailed history. Then you have to find clinical findings as mentioned previously. You can perform a Sherman test. What is basically Sherman test? I will tell you in the forward slides. NDSSA, NDSSB, you can do these type of the tests as well, and you can do a labial salivary gland biopsy as well. So this is basically a Sherman test. In this picture you can see uh, there is a filter paper. This is a filter paper that is being placed inside the eyelid, and this is the purpose of placing this filter paper is to measure the quantity of tears produced by the eyes over a fixed period, usually around 5 minutes. The what is the purpose of it? To basically diagnose why eye syndrome, which is basically your Sjögren syndrome, check the function of lacrimal tear glands, and diagnose Sjögren syndrome, which is basically an autoimmune disease, as you all know, causing dry eyes and dry mouth. So it assesses basically tear production before the eye surgery. It evaluates patients with burning, irritation, redness, or excessive tearing. It can be sometimes due to dry eye. So what is the basic principle behind it? A special strip of filter paper, as you can see in the picture, it is placed here, it absorbs tear from the lower eyelid. If there is more wetting, basically it means more tear production. And if there is less wetting on it, it means there is reduced tear production, which can lead to basically it's a dry eye. So the equipment needed is you need a sterile thermal filter strip, which is around 5 millimeter by 25 dimensions. You have to have a stopwatch or timer. You need to place gloves on yourself as well. So, what is the procedure step by step? Step one, you need to explain this procedure to your patient. In step two, you ask the patient to sit comfortably. In the step three, you bend the thermal strip at the mark line about 5 millimeters from the one end. In the step four, what you do is you place the bend inside of the lower eyelid at the junction of both the middle and outer one third of eyelid. And in the step five, you repeat to the another eye eyelid. Step 6, you ask the patient to gently close the eye or keep them gently open according to the method. Step 7 is basically you wait for the 7 minutes and you can on your stopwatch. And step 8, you remove the strip and measure the length of the cut area in millimeters. Okay, so this is how you perform thermal test. Okay, so what are the normal values? Wetting, if the wetting after 5 minutes, you can see that there is more than 15 millimeters, then it can interpret that there is normal tear production. If there is between 10 to 15 millimeters, it tells there is mildly reduced. And if there is 5 to 10 millimeters, then you can suspect it's a moderate dry eye. But if it's less than 5 millimeters, it means that it's severe dry eye. So normal reference value can vary slightly between the clinics. You can say that. Okay, so normal result will be tear production is adequate if the wetting is usually more than millimeter. Abnormal result would be wetting is less than 10 millimeters. It suggests decreased tear production. It may indicate dry eye syndrome, Sjögren syndrome, technical gain dysfunction, age-related reduced face adhesion. Okay, so what is basic advantage of this test? It is simple and quick. It's inexpensive. It's non-invasive. It's easy to perform in outpatient clinic and it helps to diagnose dry eye disorder. Okay, the indications of it are the patient is having dry, gritty or burning eyes, eye irritation or redness, suspected dry eye disease, Sjögren syndrome, contact lens intolerance. Okay, so what is the referral pathway? First, the patient comes to you, then you have to send such patient to the rheumatologist to rule out any kind of the joint disorders. Then they can send it to the ophthalmologist if they have any dry eye. So in this way, this happens, and long-term care can be provided to the patient. Case one, let's discuss about it. There is a 52-year-old female which comes to your clinic and complains, my fillings keep failing. You examine them, there were 16 new cervical lesions. Dry, you can see on examination there was a dry tongue, no saliva. Diagnosis you made was primary Sjögren syndrome. Okay, what was the outcome? You referred the patient and you started treatment, and no new caries after the preventive program. There is another case, young dentist with no symptoms. Patient returns 1 year later, needed multiple extraction. Diagnosis was delayed in this case. So in this case, basically the patient, doctor couldn't identify the Sjögren syndrome, and which led to the multiple extractions. And because of this delayed diagnosis, early referral basically could have prevented the loss in this case. So this is learning thing for us. Clear clinical scenario: patient keeps changing toothpaste, keep buying mouthwash, nothing helps. Problem is not the toothpaste, problem is autoimmune disease. Okay, so this is something that we encounter a lot in our daily routine with the patient. Okay, dental management. What you can do is you can frequently recall them after 3 months. So you can apply the fluoride varnish due to the cervical caries, and high fluoride toothpaste you can recommend to them, and you can do a minimal intervention in the patient. How can you basically manage the xerostomia dry mouth? You can basically advise them to keep hydrated, take a lot of water, to shift towards sugar-free gums, and use saliva substitute. Artificial saliva you can also test artificial saliva if there is a lot of issue. You can prescribe them xylitol gums. That will be basically that is anti-carcinogenic, and You can tell them to avoid alcohol mouthwash. Okay. So how can you basically prevent caries? High fluoride toothpaste. You can advise them. You can advise them to take a diet rich in fluoride and calcium phosphorus. You can apply serums on them, and you can recall them visits. Okay. Managing candidiasis, you can recognize it. You can treat it. You can apply topical antifungals on it. You can improve saliva. Okay. Prosthodontic cavities, what the case is, dry mouth basically leads to the poor suction, which can lead to the loose dental solution. What are the solutions in this case? You can prescribe them saliva substitute, artificial saliva, soft liders, and if not, they will be treated. If we talk about isolated challenges, we can have problems with the bonding, isolation, and moisture control carries in carry-based environment. So you need to know that. Orthodontic consultation, there is high decalcification risk, and it basically needs fluoride therapy before orthodontic treatment. If we discuss about periodontal constipation, there is a lot of plaque inflammation in these cases. There is inflammation of gums, and it should be maintained. It should be scaling done, scaling policy, and the level health is being improved. Lifestyle advice for people them we could tell them to hydrate themselves, avoid smoking, avoid alcohol, avoid sugary drinks, use humidifier. Okay? Foods to avoid, what you can say them, don't eat spicy food, don't eat acidic food, don't eat very salty food, and don't eat sugary beverages. What foods you can recommend them? Water, cheese, sugar-free gums, soft moist food, quality of life. If you talk about quality of life, such patient have difficulty in talking, difficulty in eating, social embarrassment, sleep disturbances as well, and mental effect. Their mental effect is also affected a lot. Dentist checklist, what you can do is maybe you can check about dry mouth, dry eyes, multiple cervical caries, carotid swelling, burning mouth, and epidem. Myth versus fact, dry mouth is normal aging. False. Every dry mouth is Sjögren. This is also false. Dentists can diagnose Sjögren, often first to suspect. Key take home messages would be don't ignore dry mouth, look beyond cavities, recognize the red flags, refer early, prevent total loss, improve life. Okay, so these are the take home messages for today. Don't ignore dry mouth, look beyond cavities, recognize the red flag, refer early, and prevent total loss, improve life. So this was all about our today's session. I hope it was a fruitful session with you guys. I kept it short and crisp, just because highlighting that how to detect problem syndrome, as in what is the basically dentist role in it. If you guys have any question, you can ask in the chat box. And don't forget, today is World Problem Day, July 23rd. So it's our duty as a healthcare professional to spread awareness regarding it and to detect it timely so that patient doesn't get misdiagnosed. Okay, so this is our duty. Okay, so if there is no question, then we can conclude the session. Thank you very much again. Allah Hafiz.